Life Unrehearsed, brought to you by Flora Lee Senior Residences. Always there for you. Safe, reassuring, and comforting. We call it home.
Number of vaccinations, it's so encouraging. We have both been very fortunate and got our jabs in the arm in the last couple of weeks. And if you really think about it, it is a miracle. You talk to the scientific community, and to get something so quickly, a lot of it is due to technology. And we wanted to dedicate a portion of Life Unrehearsed talking about technology. And so this is why we have this. Can't wait to hear our next guest, Corey.
So let's talk about the advancements in technology, particularly in the health sector. We're making a difference in many, many, many lives of people, of patients, of our community. In fact, the 2021 Health Technology Trends to Watch report was recently released, and it had some very encouraging and exciting findings. So let's talk about it. So in order to talk more about it, I certainly can't present the information. So we have Kristen Moulton. She's a manager of program development, medical devices, and clinical intervention. She's with the Canadian Agency for Drugs and Technologies in Health. Kristen, welcome to Life Unrehearsed.
Hi there, and I often stumble over my title as well, so it's all good.
My gosh, it's a long one. So let's look at that title. I can't even pronounce names, so thank you for having a name I can pronounce. So first, I want to look at the title. What is the Canadian Agency for Drug and Technologies in Health?
That's a great question, and I've been working here for a while, and I think it's a question my family still has. We're not exactly a household name. But we're known as CADDIS, and we were established more than 30 years ago to lead a coordinated approach to evaluating healthcare technologies in Canada. So when I say health technologies, it's a lot of things. It's drugs, it's medical devices, which are everything from, Band-Aids to CT scanners, diagnostic tests, medical procedures, and other clinical interventions. And we do things like evaluate the evidence regarding a health technology. So is it effective, and does it bring value to both patients and the health system? We make recommendations on new and existing technologies. We scan the horizon for sort of those new technologies and trends, and we help decision makers keep pace with technological change. We are non-for-profit, and funded by the federal, provincial, and territorial governments, except for Quebec. But there is a similar organization here in Quebec, INES, that we work closely with.
Yeah, it's comforting to know that this is out there. And so, Kristen, can you give us some examples, some real examples of what the organization is doing to bring real value to Canadians?
Yeah, so since we, are talking about the health technology trends, I will focus on sort of some examples from our horizon scanning work. So in terms of new and emerging technologies, there are a lot of technologies in development. Some will never make it to market, but others will and have potential to change how healthcare is delivered. And those might change how we usually do things and might make older technologies or treatments obsolete. And so without a sense of what the future holds, it is hard for health systems and for healthcare decision makers to adjust. They need time to prepare for change so that they can make good decisions about how and whether to implement something new when the time comes. And they need to understand how the technology might have an impact on patients, on healthcare workers, and on other parts of the system. So what we do, we're regularly scanning for information sources for health technologies that could significantly impact the Canadian healthcare system. And so that helps decision makers decide, will they procure, will they decide to use or integrate a technology, and how do they prepare for that integration? Mm-hmm. And we have expertise in research and analysis, and help people understand what the evidence is telling us, and then our networks share that information with policymakers and healthcare providers.
Mm-hmm. That's Kristen Moulton telling us about On Life Unrehearsed with Matt and Corey, talking about the latest technologies in health that could actually transform the healthcare system. So there's a lot of marketers out there. There's a lot of great marketers out there, and they present stuff with minimal evidence-based data. How does your organization provide assurances to Canadians when you're putting out those recommendations?
Yeah, good question. So we have been doing this for more than 30 years, and I am proud to say that CADDIS is well known in the scientific community for the quality of our assessments and the rigor of our work. So we have in-house staff with expertise in health technology assessment, in health economics, in qualitative research, in ethics, and so much more. And we also have an amazing team of medical librarians who are expert in finding the information and accessing and searching the scientific literature. We have an amazing team across the country who are aware of what kind of decisions need to be made and what is needed in order to help support those decisions. And so they help bring that evidence to Canadian healthcare decision makers so that we have access, as those in Canada, with evidence-based healthcare. And beyond considering the clinical and economic data, we also post our reports for feedback on our website for stakeholders across the country that include patients, caregivers, and the medical device and drug industry as well. So we aim for a high level of transparency and engagement so that you can have a high level of trust in our work.
And trust in the work is right. I love that. You know, you're separating the smoke and mirrors from the real deal in terms of data. Okay, Kristen, you've talked about CADDIS. Okay, let's just to remind people, that's an acronym for the Canadian Agency for Drugs and Technologies in Health. Let's get some real examples. So let's bring us back a few years where CADDIS might have made some recommendations or brought Canadians aware to some new technologies that are actually now, a few years later, right now being implemented. Can you give us a couple of those examples?
Yeah, sure. And a great example is in digital health. So it's something we've been highlighting for years. And now, you know, with COVID, the uptake has advanced and, we see that dramatically. And, digital health is a large term, but a practical example is with remote cardiac monitoring. So remote monitoring of devices for heart disease. So some patients with heart conditions have devices implanted to help manage their heart rhythms. And those devices can be communicated directly to a doctor's office. So that allows the medical team to review their heart activity without a patient actually being present in the clinic. And back in 2015, we identified remote monitoring as an emerging model that could help improve patient care. And today, I think it's 5 provinces that have dedicated remote monitoring programs for cardiac patients. Yeah. And post-COVID, we might see a few of those more like this pop up too.
What about things like online therapy?
Yeah, we've done a lot in online therapy. We've done several reports identifying virtual visits for primarily mental health disorders and mental health issues where, we identified that early as certain platforms that allowed for those types of visits to prepare for more uptake. And I think we all know that COVID has really increased that as well.
Yeah, it's funny. Timing is everything. And one of the benefits of COVID, of course, is everyone has become virtual and online. And there are some significant benefits for the end users. And okay, Kristen, the moment we've been waiting for, we first have to head out to traffic. However, when we come back, we are going to talk about, you just had a beautiful article, 2021 Health Technology Trends to Watch For. We're going to hear about 3 or 4 of those major technologies that are coming our way, and we can't wait to hear about it.
Life Unrehearsed, brought to you by Leanna Senior Transition Support, specialists in downsizing and seniors residences.
We're talking about the latest technologies in health that could transform healthcare with Kristen Moulton from the Canadian Agency for Drug and Technologies in Health. That is such a mouthful. Kristen, we want to get to the nitty-gritty. I'm very excited to hear more about these top technology trends to watch for in 2021. Can we start with wearables?
Sure, yeah. So wearables are also called connected devices, and they're embedded with electronic sensors that are typically used for patient monitoring. So they're sort of like your Fitbit or your Apple Watch, but they are for specific medical use. And they've been developed for use in healthcare, and the use continues to grow. So one that has recently been developed is for people with either nightmare disorder or who have nightmares associated with post-traumatic stress disorder. And it's designed to learn the wearer's normal vital signs and sleep pattern and detect changes in them. So it's worn on your on the wrist, like a smartwatch, and it figures out when an individual's normal sleeping heart rate or body movements have changed. So it senses a change and suggests that nightmare, and it vibrates to stop the nightmare but not wake up the user. And so it was approved last year for the FDA.
That is wild, and just one little example of how a wearable is changing things. And there's so much we have to talk about, Kristen. Let's switch gears a little bit. I know there's a lot going on augmented and virtual reality. There's probably tons of examples. If you were to give a couple examples that you would talk about, what would you mention?
Yeah, they're pretty exciting for sure. And most of us think of virtual reality in terms of video games, but it is playing a growing role in healthcare, either through sort of video game-like activities or other functions. So there's one technology that combines an exercise bike with Google Street View to allow for older adults with dementia to sort of ride through their old neighborhoods or ride through a familiar place, getting some reminiscence as well as exercise. There's virtual reality headsets that combine audio and video to deliver cognitive behavioral therapy and mindfulness and other self-management skills. And, for people with chronic lower back pain or fibromyalgia to help reduce the need for painkillers like opioids, which is kind of cool. And, there's also distraction therapy using virtual reality where some people experience pain and anxiety and distress when they undergo a medical procedure. So with virtual reality, they can use it to enter an environment that's distraction and to help minimize the anxiety associated with a medical procedure. And that can be for both adults and children and for anyone.
It's absolutely amazing. I'm sitting here in awe, listening to all of what's coming, what isn't, and what's coming in the future. What about AI, artificial intelligence?
Yeah, artificial intelligence is huge in healthcare right now, particularly in fields such as medical imaging and diagnostics. So AI software can not only enhance images, so like those taken by a CT scanner, in order to be able to produce a readable image at a lower radiation dose, but also can act sort of like a second set of eyes, alerting the imaging professional to potential markers of disease. Another cool thing that AI can do is read and translate facial movements into commands to help move wheelchairs. For those who need them. And so there's so many ways AI will and is already affecting health technologies, or health and healthcare. So it'll be interesting to see where else it goes.
Oh, yeah, just an expanding field and very exciting as to where it could go. You're listening to Life Unrehearsed with Matt and Corey, and we're talking about the latest technologies in health that could transform healthcare. And we've got Kristen Moulton on the line from the Canadian Agency for Drugs and Technologies in Health. Okay, Kristen, we're going to keep going, and we're going to switch it over to COVID-19 related technologies. They're coming fast and furious. Can you rattle off a couple that could be interesting?
Yeah, and it's hard to talk about COVID without talking about testing. So even as more of us get vaccinated, testing will still be important. And so there's a few tests that may help in the future. So one would be during future flu seasons. There's some new tests that have been approved that test for both flu and COVID. So hopefully reducing the number of people that need to be fully isolated once you figure out whether it's flu or COVID. There's tests that have been approved for home use in the States, and the FDA has even given authorization for home use of tests that use saliva samples instead of nasal swabs. And so those have the potential to make testing much easier and more convenient. And I'm sure there'll be even newer tests to come out that there's a lot of potential for, more rapid use, even post-vaccination.
I'm all for that. So it's encouraging to hear that. Okay. Let's be honest. There's lots of information. We can have a great discussion on all the information, health information that comes out. But the truth is, some of it is legitimate and some of it is not so legitimate. Can you comment on what are they, programs such as Goop, for example?
Yeah, so there's, disinformation is a real concern right now. And so when you do look at health information, I think it's important to take a moment to evaluate, where is this information coming from? What kind of website is there? If you're reading the website, look for the author's name and their institution, the publication date. All of that should be clearly marked. Any advertising should be clearly marked. And who owns and funds the site should be marked. Evidence, is this information evidence-based and objective? Are they selling you something? Those kind of things are really important. And if we do have a really good one-pager called, if you go to the CADDIS website, caddis.ca, and search for Dr. Google, you'll find sort of a one-page tool that we've created to help people evaluate the credibility of websites that offer healthcare information.
We're going to give another shout-out to that website. So can you spell it for us? Because it's CADDH.ca. And of course, that stands for the Canadian Agency for Drugs and Technologies in Health. Kristen Moulton, thank you very much for taking time on a Saturday to really enlighten us. It is very exciting and encouraging as to what's on the horizon, and some of that stuff is not far away, as we clearly saw with some of the online activities. So thank you for joining us on Life Unrehearsed.
Thank you so much.
All right, that's Kristen Moulton from the Canadian Agency for Drugs and Technologies in Health. All right, Corey, we've got a great show lined up for next week. What do we have?
So this guy's been taking cocktails to the art of cocktail making to a whole new level. You're going to meet the founder of Isolation Cocktails. And we're also going to be talking to the president and CEO of the Arthritis Society for some information that you need to know.
Yes, very fortunate to have her coming on the show. So any of you that may know someone suffering from arthritis need to tune in. So thank you for tuning in to Life Unrehearsed. And as a reminder, for all your inquiries or assistance with retirement homes, seniors residences, downsizing, it'd be my pleasure to help. Matt Del Vecchio. Our services are completely free. Call me at Lianis Senior Transition Support at 514-622-8074 or lianisservices.com. Many thanks to our technical producer, Jimmy G. Great job again. And you can listen to Life Unrehearsed here on CJD 800 every Saturday at 3 p.m.